The Boston Public Schools and Boston Teachers Union have reached an agreement for a much more extensive return to in-person learning. This will begin February 1st with high-need students and continue with elementary grades a month later. But even with reopening for all grades, most students will be on a hybrid schedule. To tell us about the plan and what made it possible is Boston School Superintendent Brenda Cassellius. Thank you very much for joining us again, Superintendent.
Great to be with you, Chris.
I want to start with the possible gains from all this additional in-person learning, all those things that people have fallen behind on, whether it's academic or social and emotional condition. What's the hope here?
Well, the hope is that as we return to in-person learning, that students will be able to get the services that they haven't been able to get for the past year, as well as be in their classrooms with their loving teachers and have their social emotional needs met. That is the biggest bonus, we believe, especially our students with disabilities that will be returning, where many of them haven't been able to get some of their physical therapies or some of their medical procedures. And so we're really excited to be able to provide that to them in person.
Well, when I look at the state figures around Massachusetts, hundreds of cases are reported by school districts every week. So what's the realistic goal here about, making the pandemic risk manageable?
Well, we put in a lot of safety precautions all year in order to be able to get to this place of opening up all 125 of our schools again. As you know, we tried that October 1st and then the numbers went up and we didn't yet have air purifiers. And at that time, we were learning a lot more about the science and a lot more about this virus and how it spreads. And we really felt that we needed to have those air purifiers. We had the wonderful advocacy of the union helping us pressure that and pressured at the state. So the state did provide us with air purifiers, as well as then doing some air monitoring testing at our school sites. That's really the first step in our precautions of our facilities and the cleanliness of our facilities and ensuring that we have enough hand sanitizer, soap, and that we're using the disinfectant foggers that get into the little areas that would maybe host the virus. And then, of course, there's also our personal health and safety and the protocols we take, which is the social distancing at 6 feet, as well as the masking and ensuring that that's occurring at the site. And then also, what do you do if there is a case of COVID where someone comes to the school that is ill or tests positive and has been at the school, maybe was asymptomatic, and isolating and quarantining those individuals and ensuring that we take the health and safety precautions so that they don't come back to the school until they're clear of the virus. And so we think those pieces are going to really help us mitigate the spread of the virus. We have not had any cases of transmission in the Boston Public Schools. That doesn't mean that we have not had cases of faculty and students who have had it. We have a dashboard that gives all of that information to our public transparently by school, the number of cases that we've had that have been brought into the school and that we then had to isolate or quarantine.
That's an important distinction to make because, adults and kids will continue to be infected for, months to come. But at the same time, when it comes to catching the virus in the school, what's the difference?
You catch it before they can spread it and transmit it to others. And that's the really big difference. So we ask our students and our staff not to come to school if they're not feeling well. If they are, our nurses are trained to identify it. And then we have isolation rooms. So we quickly isolate them, and then we expect them to get a test prior to them being able to be returned. So they have to have a negative test. So that helps us mitigate any spread, even if it is brought in, because so many individuals do have COVID who are asymptomatic. And so we want to make sure we have that extra cautionary practice in place in order to mitigate any of the spread within our schools.
By the way, what about access to testing under this most recent agreement with the teachers union?
Well, this is another area where the state has stepped up and said that they would be a very good partner with us in helping us to expand and test to students. Of course, you know, we have 53,000 students, and that just really would be very challenging, both operationally and financially, to test students every week. So the state has stepped in to support Commonwealth districts and also provide that testing. We have been doing testing since December with our upper grade students, and that's been a pilot that we've been doing in partnership with the Boston Health Commission. And we'll continue that into next week, and then we will begin working collaboratively with the state on their testing of teachers and, or excuse me, all of our staff and our students.
One thing I expect will continue is that families will still have mixed opinions about how safe it is to go back to in-person learning. So if people want different options, or if they want to change the option they've already signed up for, what can they do?
That is correct, Chris. We have been asking our parents to let us know by January 29th if they would like to change the mode of learning for their child, whether in person or whether remote. That's really important for us to honor family choice. And so we've been doing that all along this pandemic, and allowing parents to let us know. So if they could let their teacher know, or their school leader know, or they can call the district office as well, and we can help them out.
One of the other things that occurred to me is that with remote learning, there have been problems with spotty internet access, or maybe students who don't want to be visible on a Zoom session, partly because of bandwidth reasons. Any opportunity to give them more help with more access to in-person learning?
Yeah, I've been very proud of our team and actually our partnership with Mayor Walsh in the city around access of Chromebooks. And, we've given out nearly 50,000 Chromebooks to our students, as well as internet access. We've forged partnership with Comcast Cable and given vouchers so that it's much easier for our families to access free or low cost high speed internet. And then also we have hotspots that we have purchased and been able to provide to our families that are in need of a hotspot because just their location does not provide for the Comcast internet. So we have found that that has been less of a barrier for us around internet access than maybe other more rural areas have had more difficulty.
Well, talk about the timeline, because for the month of February, I think this is still just going to be more in-person learning for students with high needs. So what about the pacing after that?
Yeah, so for the very first week back next week, it'll be the remainder of our students who have high needs, but also we're expanding to homeless students, students who are in the care of our Department of Youth and Family, as well as some of our students who have had difficulty accessing remote learning because they're not yet speaking English proficiently. So those are our English language learners. So they'll be able to return as well next week. And then there's a small group of students who will be able to return next week that our principals really do know that need some extra help. Then they've been on a success plan. So we're making some exceptions for some of those students because they're in situations where we know they need to be in school. And then we'll start back for our general ed population with our younger students on March 1st. That's our K0, K1, that's our 3 and 4-year-olds and our kindergartners. And then we'll move to our upper grades, or our middle grades students, grades 4 through 8 on March 15th and 18th, meaning, because they'll be in group A and group B, and then March 29th and April 1st for our grades 9 through 12.
I know the numbers on the virus have been going in the right direction, especially the last couple of weeks. There's also fear out there it could get worse again before it gets better again. So are there preparations for a worst case?
Well, one thing we've learned about this pandemic is that it does ever change. And so, we've been getting changing viruses, new variants. We've been having different science about, how you mitigate the virus. So there has been just an enormous amount of shifting and changing, and that's made it difficult for us as we've tried to prepare for our return of our students. But like you said, the numbers are going in the right direction. So we're hopeful. And that's why we think we'll be ready to open next week. And of course, for a while, we will be living with COVID. And we know that this is true until we get either herd immunity, because we have this broad vaccination effort that's hopefully going to expand even further under the new administration.
You should also mention there's going to be more information available at a virtual meeting later this week.
That is correct. So we have a meeting coming up, I believe it's this Thursday, and we will be giving further information at that meeting. And you can find all of that at bostonpublicschools.org.
By the way, as far as information in different languages aside from English?
Yes, we do have meetings as well in other languages. We've been really trying to have interpretation services and translations. And so if you go to www.bostonpublicschools.org/reopening, the information is there for parents, or you can also call our parent hotline.
Thank you very much for taking the time to join us.
Thank you so much for having me, Chris.
Boston School Superintendent Brenda Cassellius. We'll have more news in just a moment.